This is All India Radio. In the program Spotlight Now, we bring you a discussion on decline in female infant mortality rate. The participants are Neera Mishra, social activist and expert on women issues, and Urmi Goswami, journalist.
The recent data on infant mortality rates shows that the gender gap has reduced considerably. At the All India level, there are 28 live births per 1,000. So that basically means the gender gap at the All India level has been closed. Clearly, one of the big factors that has led to this situation is the Beti Bachao, Beti Padhao schemes and mission at one level that the government of India has, as the Prime Minister himself has piloted a great deal. I'll be talking to Neera Mishra. Neera ji, how do you see this IMR data, and where do you think the wide variations that I just referred to, and where do you see the Beti Bachao, Beti Padhao impacting the outcome that we are seeing?
It's a very interesting and a very positive news that we have got, and the ignominious reputation that India had of having a very pathetic female, IMR, we have now 2020's report come to a point where there's a very progressive and a hopeful journey that we see that in future we'll be filling the gap. What I observe in this report, all these findings is that two things. One is that, of course, it's very nice that the gap has reduced, but still there are a lot of issues like in the rural areas, we don't see much of an improvement, and marginally the improvements we notice are in the urban areas. Now, this very clearly points out to the fact that being a country as large as India, and the mission mode in which the Honorable Minister of WCD has taken this on under the leadership of our Honorable Prime Minister, the impact has been substantial and still a lot needs to be done. These things take time, and what we see now is that the gaps that have been certain states that we will take one by one have been not much of a happy news, but certain states, yes, they have been very, very positive. What the Beti Padhao, Beti Bachao program of the Ministry of WCD has achieved this mission mode on taking this issue on a very integrated way. So they have sort of worked on the health scheme, they have worked on the education, and they have also worked on awareness. So these are very three important critical steps that have been done. And I think that has paid off in the last almost 8 to 9 years of work that has happened. So we are very happy about this. And I'm sure with this momentum moving, very soon we will be hearing of very good news.
But one of the things that I find interesting to think about is that now that we are, in a sense, on a pathway where more girls will survive, will make it to their first birthday, we have to turn our attention a little bit to what happens beyond the first birthday and what more needs to happen within the Beti Bachao, Beti Padhao scheme to ensure that more girls make it. So some of it will be momentum, some additional efforts need to be made, and what needs to happen so that girls can make it now beyond their first birthday to their fifth birthday and so on and so forth to lead more fruitful and productive lives. So I'm wondering if you could tell us a bit about what more needs to happen both within the scheme and in other policies that kind of buttress the scheme.
Well, the policies are already in place. What needs to be done is to ensure that the implementation of these policies is more effective. What happens is that since we work in the rural and the urban areas, we do notice that there are gaps between the rollout of the policy and the implementation of the policy. So those gaps need to be really sort of scrutinized and filled. Number two, I feel that more awareness for the parents have to be given on the equality, the gender equality, and how a girl is as important a part of the family as a boy is. And thirdly, again, the health services that are improving, but there is always room for improvement. So in every aspect, what I feel is filling the gaps where the momentum not only gets more expedited, but there is better implementation and greater awareness among the masses, especially the rural areas, is not such a positive thing. And so I think that's where we need to focus on and involve people. Maybe the social media can play a very critical role in this. We have this community radio services, we have this WhatsApps, and different social media needs to be more positively utilized for creating the awareness on these issues of not only having a child survive 1 year, as you said, but not only 5 years, she should be a healthy, living, contributing factor to the nation building throughout her life. We have to equip her with those things right from her childhood. That means her mother gets good nutrition, she gets good nutrition, she gets good education, and she gets good skill training. It's an ongoing process.
As the data shows, but you mentioned very clearly about the gap between rural and urban and awareness. Is there a skills gap in terms of people equipped, to provide the right kind of advice? And that would impact, of course, IMR for both boys and girls, but definitely awareness that, as you said, girls are no less valuable to their parents than boys. And is that a skills gap? Do we need something more there? Maybe find training in communication or something to already existing workers. Is that a gap?
Yes, there is. I have found a gap between the training of the Anganwadis, and we should not leave it only to the Anganwadis to take this forward. There should be a proper communication and some sort of a awareness program for the general public at large, especially in rural areas, the women, the girl child, even the to-be mother. All these things are very critical, where we find somehow, what I find is that in a Sarkari movement, most of it is left to the Sarkari officials. Now, we need to bring in the people who are in the social sector. And I feel that if we are very seriously wanting to convert this into a very positive step in the next 5 years, a committee of committed people needs to be created in the Ministry of WCD, who will not only ensure that the skill gaps and the other implementation gaps are addressed, but there will also be an advisory board to the ministry. Because depending too much on officials becomes, I think, at times a little of a bondage and little of a hurdle.
Right. So you're talking in terms of involving all stakeholders, which would actually even include the recipients of these programs to be part of it, so that it becomes more meaningful and organic in terms of its rollout. That's a very interesting sort of observation. I wanted to bring you back to the IMR data, and clearly, as you mentioned, the Beti Bachao and Beti Padhao scheme program has actually helped a great deal. It kind of, in a sense, has made it very clear and put it front and center that children are valuable. But when we are looking at this data, there's something very interesting that one observes, that by and large, of course, there's been a reduction in the IMR among girls, which is great. But there's a gap, and it's still a very small gap in most cases. But when it comes, and of course in some states, in 13 states actually, the IMR among girls is lower than among boys, and in 5 it's equal, or the gap is much smaller, and in 5 states it's equal. But the question I have is about 2 states, and that's Kerala and Himachal Pradesh. We observe the reverse trend, and in that case, the male IMR is 3.33 times more than that of female IMR, and in Himachal Pradesh, it's just a little shy of being twice over. Is that a cause for concern?
Oh, yes, it's a very, very serious cause of concern. Why? I'll share a very small incident of Uttar Pradesh, where I had gone to visit the status of education of women, girl child. What I noticed was that because there were so many incentives given to education of girl child, everybody was sending their girls to the schools, but the boys were being neglected. And after about 10 years, there were a lot of high school girls, class 8 and 9 passed, but there weren't sufficient boys. So the villagers themselves felt that there was a lot of inequality happening, and the boys felt also. Same thing I noticed here, that too much, it could be for 2 reasons. One is because there's so much of incentive being rolled out for women, people are cashing on that scheme and neglecting the boy child. The other could be, which I am not sure because I don't think any study has been done, has it been properly utilized for all infants?
So how do we ensure that the good that a program like Beti Bachao, Beti Padhao can do does not get gamed and do harm, because we ultimately don't want to turn the clock, swing the pendulum in the other direction. We want all children to be able to make it to their first, fifth, and subsequent birthdays.
I personally feel, since the Ministry of Women and Child Development, the word child is very significant here. So wherever there are schemes related to the health and welfare and education of the child, the scheme should become gender neutral. There are certain specific schemes for women to take care of their pregnancies, their pre-pregnancy, post-pregnancy health issues, their skill development, training, etc. But when it comes to the child part, I think that government should become more gender friendly and name it also gender friendly. Beti padhao, sab bachcho ko bachao.
The reason why I asked you is because it's not as if government hasn't had this gender neutral approach towards children's education. I mean, when you look at Sarva Shiksha Abhiyan, when it first started out in 2003-04, most of its time it has been gender neutral, or the ICDS program. In that sense, it's gender neutral. The Anganwadi scheme is gender neutral. And yet, we didn't see the impact on female IMR or female mortality rates up to the age of 5. We didn't see the kind of impact we're seeing now. Part of the reason why the government had to go into overdrive and make a special case of Beti Bachao, Beti Padhao is exactly that, because there was this deep-seated kind of social or mindset issue. When you're saying that go gender neutral, are you saying that the benefit that a focused drive on girls can give has been gotten and now it's time to revert to a gender neutral? Do you think that we need to put our thinking caps on and come up with another version which takes the conversation forward?
Yes, I think we need another version, because definitely this has to move on. But while it is moving on, we can't just move on one rail. We have to take two rails together for the train to move forward. We don't want it to be falling off track because suddenly we find that the right arm is helped but the left arm is not working. So what I mean to say, we need to look at, especially in the younger age. See, Sarva Shiksha Abhiyan comes into focus when the child is about 4.5 to 5 years old. Before that, it has to be gender neutral, so that both the girl and the boy and the people are also getting enough attention, both the male and female. After 5 years, of course, the Sarva Shiksha Abhiyan is all for there. But if the boy's IMR is like falling.
So basically, we need to have more gender neutral sort of elements while still guarding against the social issues that kept girls on the back burner to address them. So it needs to be recalibrated, and I think part of the recalibration is happening with revising, looking at the scheme as the government has recently done. I have a final question for you, and that relates to yet another of the data throws up, and that's in Madhya Pradesh, where there has been a decline in the total IMR, and yet actually female IMR has risen compared to what it was. So again, that's cause of concern, isn't it?
Of course, any state which is not taking care of the female IMR, I mean, it is a cause of concern. And we have to actually, it's very difficult to give a generalized answer to these things. I don't think that the Madhya Pradesh government is lacking in implementing the Beti Bachao, Beti Padhao scheme or all the other child-related schemes.
So basically what you're saying is that there has to be a more focused study trying to understand where the gaps.
And it should be a continuous process, because what happens is that people get laid back and it's just going on rolling without taking a feedback whether it is rolling effectively or not.
While the road ahead is still long, and clearly this is one of those issues where success is always incremental and there is no final destination. Success has to be a constant effort, so much more needs to be done. But nonetheless, this is clearly an important milestone where the gender gap in the infant mortality rate, that is the number of live children who live to see their first birth, 1,000 live births among girls, has increased. Thank you so much, Neeraji, for taking us through the implications of this data and the impact of the Beti Bachao, Beti Padhao mission. Thank you.
Thank you so much.
You were listening to a discussion on decline in female infant mortality rate. The participants were Neera Mishra, social activist and expert on women issues, and Urmi Goswami, journalist. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app News on AIR. This program is also available on our YouTube channel News on AIR Official. You may email your opinion about this program at airnsdtalks@gmail.com.